I have my Medicare card, and on December 1st, I start the next chapter of my retirement. In this video, I'm going to explain why I'm sticking with original Medicare. Joe Namath and Jimmie J.J. Walker may try to sell you on the Dy-No-Mite reasons to go with a privatized version of Medicare, but in this video, I'm going to cover 4 disadvantages of the Medicare Advantage plans. When you turn 65, there are 2 main ways that you can get your Medicare coverage. You could stick with the original Medicare plan, and you'll have Part A, hospital insurance, Part B, medical insurance. And if you go down that path, you're likely going to add a Part D prescription drug plan and a supplemental coverage like Medigap policies. Or you could go with a Medicare Advantage, also known as Part C, and that is a privatized alternative to Medicare. Basically, you won't use that Medicare card you just got. You'll get an Advantage card. They will combine Part A, Part B, most of the time Part D, prescription drug, as well as benefits that you don't get with the original Medicare plan, like vision and dental coverage, sometimes even gym coverages. Now, Medicare Advantage plans have been around since 1997. There have been various attempts to privatize to see if private companies could run Medicare better than the U.S. government since the 80s. But it was the 1997 Balanced Budget Act, yeah, isn't that funny, that introduced the Choice Plan. It was later renamed the Medicare Advantage Plan in 2005. Medicare pays a fee to a Medicare Advantage insurer for every enrollee that joins their plan. And then they're in charge of managing that care from then on. I'm going to show you a few reports here on research that I've done about the Medicare Advantage and some of the disadvantages I've found. I'll put links to all of these reports in the notes below. Now, the Kaiser Family Foundation does a lot of great research, and I've used them before when I was talking about the ACA plan, but they've also done some research on particularly Medicare Advantage. As this report shows, enrollment in Medicare Advantage has more than doubled over the past decade. In 2021, 26 million enrolled in Medicare Advantage plans, and if you click on the Medicare Advantage penetration, that's 42%. Now, they also show a report here that includes an estimate from the Congressional Budget Office that says by 2030, more than half of Medicare enrollees will be in Medicare Advantage plans. Another report showed that 2/3 of Medicare Advantage enrollees were paying 0 extra premium beyond the Part B premium that all of us have to pay. It starts at $148.50 in 2021. 2/3 of those that selected the Advantage plans paid no extra premiums. Of those 1/3 or so that do pay extra premiums, the average premium is about $60 a month. Now, when you lump all those free guys with the $60 a month average, you get an average of $21 a month. So no or low cost premiums is obviously one reason why people select Medicare Advantage. But as the TV commercials say, you get so much more. Vision, dental, even gym memberships. So many people sign up for Medicare Advantage plans for these extra benefits. One word of caution though, the insurance companies are free to change these after each year. So you have to look at your annual notice of changes if you go this route to see what's added, maybe, and what's taken away. But before you fall for these extras and low premium, there are 4 disadvantages of Medicare Advantage plans. First, consider the limited networks of these Medicare Advantage plans. The insurers contract with a reasonably small number of doctors and hospitals in their immediate area to provide the care in their network. As this other report from healthaffairs.org shows, 35% of Medicare enrollees were in plans with very narrow physician networks. Most of them are local health maintenance organizations, or HMOs. Even if you can get a preferred provider organization that allows you to use providers out of the network, you're likely to pay more. Also, consider as you travel around the United States, your coverage is back home. You're likely to only find emergency room care outside your home area. And don't even think about foreign travel without buying a special travel medical policy because they're not covering you outside the United States. Before you sign up for a Medicare Advantage plan, you'll need to make sure that your doctors and hospitals are in the network, and you'll need to keep checking every year with the annual notice of change because they're free to change the providers in their network. Original Medicare, on the other hand, has no networks. You're free to use doctors and hospitals that you choose as long as they accept Medicare. And while Medicare doesn't cover foreign medical care, there are some Medigap policies that offer limited medical coverage outside the United States. Since we plan to travel in our early retirement, this limited network is the primary disadvantage in my book. The second disadvantage is the whole managed care process. In my working years, whenever I had an HMO option and another option, I selected the other option. The insurers offering Medicare Advantage plans hope to make a profit with the dollars they get from Medicare by managing the care they give to you. You are likely to need a primary care physician who will write you a referral to a specialist, and you're likely to need prior authorization for many tests and services. Here are just some of the examples of the services that most Medicare Advantage enrollees need to get prior authorization: durable medical goods, some Part B drugs, skilled nursing care stays, inpatient hospital stays, non-emergency ambulance services. The list goes on. Original Medicare, on the other hand, does not require referrals for specialists, and very rarely do you need a prior authorization. Medicare reimburses Medicare-approved fees for medically necessary services, and Medicare gap policies are required to pay on anything that Medicare is paying for. The third disadvantage is cost. Wait, I thought you said Medicare Advantage costs little or no extra premium. How could that be the issue? But that's just the upfront costs. Original Medicare and a Medigap policy will likely cover all of the fees that you'll have except the Part B deductible of $203 in 2021. After that, you don't pay a dime. You do pay more monthly for the premium for a Medigap policy versus the very small or no premium for an Advantage plan. But if you're on the Advantage plan and all of a sudden you start getting co-insurances, co-pays, and deductibles that add up to an out-of-pocket maximum, this could easily erase the premium savings of the upfront cost. One serious illness or injury, and you could easily spend thousands of dollars more than you expected. This part of the Kaiser report notes that Medicare Advantage enrollees will likely spend more than they would have spent under original Medicare in a 6-day hospital stay. For shorter stays, it ends up to be less. But the study also noted that this comparison is just against original Medicare, not original Medicare with a supplemental plan. Another report noted that only 1 in 10 have original Medicare with no supplemental coverage at all. That's about 5.6 million people. And if you take out the Medicare Advantage folks from this population and look at it, that is about 17% of the original Medicare folks have no supplemental coverage. Most have Medigap or an employer-sponsored retiree health plan, in some cases Medicaid. So it's only a small number that don't have some extra help. And now you compare Medicare Advantage to original Medicare with some sort of supplement, and the stark differences start to show up. So another Kaiser report looked at a survey of Medicare enrollees who reported cost-related problems, and they compared those that have traditional Medicare only, traditional Medicare without supplemental coverage, traditional Medicare with a supplemental coverage, and Medicare Advantage. And if you look at the differences between traditional Medicare with a supplement and Medicare Advantage, 19% of the Medicare Advantage surveyed enrollees reported cost-related problems. Only 12% of those with original Medicare and Medigap coverage reported problems. And that gap is worse when you look at those that are in fair or poor health. The same survey asked those who self-reported as fair or poor health whether they had cost-related problems. And the gap between traditional original Medicare with Medigap and Medicare Advantage is even more stark. 27% of those on the traditional original plan reported problems versus 39% for Medicare Advantage plans. So the cost advantage of Medicare Advantage seems to fade the more you use the plans. The final disadvantage of Medicare Advantage plans is the systemic flaw that allows insurers to exploit the system. Insurers are allowed to change their plan every year. They can set up plans in the regions, in the local communities where it makes sense and profit to offer their services and avoid high-cost service areas. They're free to change the program. They're free to change the extra benefits. They're free to change the providers and hospitals in their network. And you have to look at it every year to make sure you're not getting exploited. Privatization isn't always for the public good. Look, I'm a capitalist. I'm all for free enterprise. But Medicare Advantage turns the consumer into a commodity for the insurance company. This report from healthaffairs.org notes that Medicare Advantage costs per beneficiary were rising faster than traditional Medicare at an alarming rate. So it's not clear that it's really saving taxpayers any money either. In another example of systemic flaws, the Office of Inspector General recently raised concerns that some of the largest insurers in this marketplace may be gaming the process to improperly boost the payments that they're getting from Medicare to cover their enrollees. The Wall Street Journal article here notes that they paid out $9.2 billion in extra federal payments based on health assessments of those enrollees. Well, it found out that half of that went to 20 insurers who were using this controversial technique to raise their payments. When you go to the actual report, it even looks worse. Those 20 Medicare Advantage companies generated 54% of the risk-adjusted payments from chart reviews and health risk assessments. Yeah, but they only enrolled 31% of beneficiaries. So they're clearly gaming the system. Later in the report, it also notes that the one top company, they don't mention a name, but you can guess the one that's connected with AARP, generated the most payouts from this controversial process. So I think Medicare Advantage works quite well For some insurers, I'm just not sure it works as well for consumers and taxpayers. Those are some of the reasons why I'm sticking with the original Medicare path. In my next video, I'll start to shop for the best Medigap policies. Stay tuned for that. Be sure to like and subscribe to this channel and comment below, what are you doing for Medicare choices? Are you there yet? Are you thinking ahead? Are you already past 65? Tell me your experiences, please. I'll conclude with my standard warning. I am not a professional. I'm not an insurance agent or broker. So take this as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need to. Thanks.